My name is Jim Hyman, and I'm the AVP of Northwell Health's HIE. I'm very happy to speak to you today about our journey partnering with InterSystems and their technology suite to support our strategic vision and growth as a leader in healthcare delivery in our region. Northwell is located in the Northeast United States and is New York's largest private employer with 23 hospitals, over 800 practices, acquiring additional practices on a weekly basis. 76,000 employees, and every type of healthcare service, making it a large independent delivery network for the 14 million patient community we serve in innovative ways. Over the last 20 years, Northwell emerged to this stature through growth and acquisitions, leaving a siloed and disparate technology landscape. In the modern age of access to data and open sharing of information, Northwell's HIE platform emerged to facilitate improvements of care delivery and coordination through interoperability and accessibility to data. In addition to bringing together the data, the platform enables the structural and semantic normalization of records, particularly enabling some innovative work around patient identity on InterSystems Patient Index, creating a truly connected experience through an aggregated, actionable, comprehensive care record. I'd like to touch upon how this technology and data backbone played a critical role over the last 19 months. As many of you are aware, in the United States, New York was one of the hardest hit areas by the pandemic, and Northwell was at the center of that storm. Northwell has tested millions of people, and during the height of the pandemic, processing over 10,000 samples per day. In the end, the pandemic has helped optimize the delivery of lab results directly to our patients as well as our providers, facilitated by the COVID CARES Act program. Results are shared across service lines to optimize care for our patients, and new critical pathways were developed to ensure the patient's COVID status was corroborated across different treatment platforms. Let me take you on a journey of a COVID test as a nice summary of how the technology was used to facilitate care delivery across nearly every facet of our platform. At the core, the integration technology consolidated records from many sources, ranging from our reference lab, urgent cares, hospitals, and the community RIOs. The data was then watched very carefully and normalized for common tests in a rapidly evolving ecosystem. Our clinical viewer display was enhanced to predominantly display a core COVID status in the summary landing page. In a time when much of our other healthcare services were shut down, the clinical viewer actually saw unprecedented and sustained growth, mainly geared to the core COVID dataset, and then continued use since. Our HIE analytics provided the most comprehensive, centralized view of critical lab stats and was used for many reports and dashboards, including our Emergency Operations Command Center, coordinating resource allocations across the system. The clinical event notification, results delivery, and data synchronization platforms played key roles in ensuring that patients and care providers alike had access to their results as soon as they were finalized. Our broader development community also consumed this information through both our APIs that we support and the messaging queues where they could bind to these tests to support our care management efforts, digital patient experience, and our innovation chatbot technologies. Finally, the testing workflow was optimized through unique experiences developed for COVID to provide a patient not only with the results, but intelligent education and communication details to speak with an appropriate care team member. In these interesting times, the workflow was vital because as a patient's normal care team was disrupted and in some cases redeployed to the front lines, and office staff was redeployed to our centralized patient access call center. All of these testing workflows provide a view into what a group of dedicated technology professionals can accomplish, empowered with the data platform and tools at their disposal. I'm now going to take you through two other critical areas that were high-value service offerings that explain the technology capabilities in slightly more detail. The monoclonal antibody infusion concoction provides a safe and effective way to substantially decrease the likelihood of hospitalization if received within the first few days of contracting the virus. As part of the workflow, there is a substantial screening process to ensure that the limited doses could go to the appropriate people. Let me describe some of the workflows enabled. An order would come in through our primary care network. Our clinical call center reviewed the referral details and questionnaire. If the person qualified for treatment, an intelligent patient list for scheduling was generated for patient access team members to schedule the patient for treatment. Also, upon the treatment decision, the referring provider, often in the broader community, was automatically notified of the decision. After the patient came in for and successfully received the treatment, the referring provider was again notified of the successful completion of the therapy. In addition, if in a rare case, a patient who received treatment had an adverse reaction or wound up in an ED from complications shortly after the therapy, a centralized SWAT team was immediately notified to respond accordingly. Northwell has seamlessly coordinated administration of this therapy to nearly 10,000 patients in our region. Transitioning into 2021, Northwell was privileged to have some of the first publicly available vaccines for our healthcare workers and has since deployed over 600,000 doses to more than 350,000 people in our community. As part of the technology response to the vaccine, we had to be creative since in many cases we're working on behalf of state and local agencies and not necessarily under our standard care practices in a very much evolving landscape. We were able to use our integration technology to bridge a brand new Salesforce deployment with our enterprise health platform. In all of the vaccine confusion, centralized master patient index was incredibly valuable as patients were frantically trying to get appointments and in many cases requesting appointments across multiple platforms at the same time. The main confusion stemmed from instances where supply and appointments would open up sooner and patients would make another appointment at the earlier date and time. The technology was used as a bridge between these solutions and used to problem solve along the way. In addition, while the vaccine itself is free, the administration of the vaccine could be billed to the insurance carriers. The technology was used then to bridge back to our standard revenue cycle systems for the appropriate billing workflows, leveraging automated scripts. Overall, the technology pandemic response was done at an incredible scale, speed, and intensity. Our agile teams deployed over 35 critical workflows with 100 plus enhancements delivered generally in hours or days from the original request. At the same time, we were supporting our broader development and application agile community, which had developed well over 100 new features during this same time. Transitioning to reopening and reimagining the way that we work, our HIA technology has played many other critical roles in coordinating patient workflows, such as coordinating COVID surgical clearance for some of the more complicated sites, and continues to help modernize the way we move forward.